Hello everyone. I'm Nilesh Maheshwari from Amorphous Health, and in today's podcast, we are going to discuss how technology can help to bring better patient engagement. And for that, I would like to call upon Mike. And before I ask him to introduce, I have Mike. I have few statistics which probably we can discuss more about. So it says that up to 70% of hospital readmissions are due to patients not following their care plans. 80% of patients want to be involved in making decisions about their care. 60% of smartphone owners utilize their devices to seek information about health conditions, like Googling a lot of information. 92% of patients expects their healthcare providers to send them personalized reminders and messages. So, so these statistics clearly say that patients want to get uh, engaged with the provider, with the hospital, and they need more information. So, so Mike, you're an expert on the patient engagement, and please introduce yourself and throw some light on these statistics. What do you think
Yeah,
about it?
I appreciate it. Yeah. So I'm Mike Lloyd, co-founder and chief product officer at Riskaverse. Riskaverse is a digital engagement and enrollment platform. Basically, we take patient engagement and then enrollment workflows and combine that into a single unified experience so that members are able to be met where they are with personalized outreach and touch points through channels like SMS, email, and postal. And then we drive them into what we call our digital care pathways, where the member is allowed to disclose information about their particular needs, preferences, and goals. And based on that information, using their coverage and what services are available to them, our platform then presents them with a personalized recommendation of what service they should enroll in, and then goes on to facilitate the enrollment of that person into that service. And I think a couple of the statistics you mentioned, obviously all of them are profound and showing a bit of a lack in the healthcare industry around it. And one of the ones that really stuck out was about the desire to have control in their own care. And today, the way we kind of see it is health plans or health insurance and providers are looking at what this person's best care is for their own interest. You know, the health plan says this is the most cost-effective solution for them. The provider might say this is the best solution for them. But at no point during that discussion was there, what does the patient want? And what is the patient going to actually achieve? And so we are taking that shift and putting that power back into the patient and allowing them to have that control through a unified experience and through unified personalized touch points around that.
And I think you're right in that the patient is the centerpiece of the whole of this ecosystem, and some of the times in all of these ecosystem players, the actual patient engagement or patient's benefits are getting lost in the motives of different parties in the system. So you are doing perfectly right, where you are keeping patient at the center, and you are traversing around for his benefit. So Mike, with increasing healthcare complexities, patient engagement is now more challenging than ever. And if any healthcare entity would like to implement a successful like patient engagement solution, what challenges do they face, and how can they solve these challenges?
Yeah, I think some of the key challenges that we see is really around what is the bandwidth of the entity. And we work really hard with the risk-bearing entities, the plans or provider groups and systems that are taking on the risk. And so that's been a big transformation towards value-based care in that regard. And so with that comes the idea that you do need to be engaging these patients with a much more personalized approach. And the other side is that the plans themselves or the systems are really overworked. You know, they have only so much that their care teams can do. And a lot of their focus when it comes to engagement is more on the phone calls themselves rather than digital channels that you would see in some of the other industries like e-commerce, where they're really hammering the digital experience and making that personalized for each member. And so we look at it that way and say, organizations that are already cash strapped or they're struggling when it comes to the workload they can output, they need a solution like ours to be able to actually engage effectively at the scale that they need to on that individual level. Because I do still believe that phone calls are essential component to this, and especially for complex individuals that have a lot of uh, secondary needs or extraneous and complicated needs. Things those members should continue to get that touch point, but other individuals are self-serviceable and they're able to navigate their care when they're fully capable of doing it. And so that comes down to really educating these individuals at the right time where they are. And so, yeah, it's going to be that workload on them. And then also a lot of solutions that are out there to date, they tend to really focus themselves around taking in a lot of data on the individuals beforehand through a really complex integration. It can be 6 to 12 to 18 months across that just to get to a start point. Ours is able to be really flexible and just launch as a standalone solution using our historical data around similar populations we've engaged with. And we can get up and running in a number of days, really days to weeks, whatever it comes down to for the plan or the system, we're able to accommodate that. So really that becomes the second piece is how are you educating the member on their individual coverage, their needs, et cetera, at a way that's scalable and can be done for that self-serviceable population group.
And that seems to be like lightning fast as compared to the typical implementation. So
yeah, exactly. I think some people we've talked to and, other organizations, it can be, like I said, that integration period of taking and ingesting that data can be up to 12 to 18 months before, from contract sign all the way to the launch period. And they're not really on the other side able to drive in and allow the member to advocate for themselves. They're triggering emails, they're triggering SMS, but it's really, hey, go join this program. That can be a bit intrusive for someone that hasn't had any touch points before. We're really, really focusing on garnering trust with the member, creating a sense of comfortability for them, and then breaking down the terminology into much more layman's terms so that the average individual can understand it.
Excellent. So, we were developing an application for which is a patient-facing application for one of our clients, and it is observed that the people who are young or below 50 are quite adaptable in using the smartphones for patient engagement messages or applications, but people who are elderly are a bit hesitant in using these channels or mobile applications or even using mobile. So how do you think these problems can be addressed for the elderly population?
Yeah, so one thing that we really look at is making the actual digital experience, our assessments where we're asking them those questions or even the messages we're sending beforehand. We're first accommodating who that individual is with an older population. What does that look like? It's going to be bolder, bigger font. It's going to be simpler, individualized pages that they can focus on at one time and presenting it to them in a manner that they are at least somewhat familiar when it comes to it. And what's great is we are becoming a much more, tech-driven population and more capable. 60 to 75% of seniors are actually fairly comfortable when it comes to using their smartphone on a regular basis. And so, kind of like I said, we can't obviously get everyone through that digital communication, but it's going to be a majority of the people that are comfortable doing that. And, there are programs out there for care delivery, whether it's, cardiac recovery, diabetes management. They are engaging in these virtual care solutions and are capable of doing it. And our goal is really just make this as simple and accommodating for that individual so that at the end, they have only one thing to do. That's make a couple clicks and enroll in that process or be connected. Maybe if they can't do it, our platform's flexible and can understand when someone's having struggles with the engagement, and we can shift them into having a phone conversation if they are in need of that. So having those resources available and understanding each individual's needs and accommodating them as they go is really important. But yeah, we really haven't slowed down in some of the populations. We've worked with Medicare Advantage, and we see 98% completion rates in our Medicare Advantage population on our health assessments. So they are really, really capable when you bring it down to that level. And I think not underestimating them is going to be a big thing, and just putting it in the language that they have seen before.
Okay, excellent. So that brings one more question related to catering to needs of different population group, because
Mhm.
every group or of people or ethnicity would have a different need. So
Mhm.
do you cater to having some personalized experience to different population group?
Yeah, we're obsessive over that. So I think you've got to look at we're multilingual country in America, and that's the
Yeah.
first and foremost biggest step. Oftentimes, when we were interviewing individuals of alternative languages, they found that they had no option in their language whatsoever. So that first touch point's already kind of lost. And then at best, what they're seeing is a Google translated version of it. And they're excited, honestly, when they get even just that version. It's not perfect, but it's better. Whereas we do have, translations on our team that can accommodate them, and work with vendors as well that are experts in that field. And it's really about surrounding ourselves with the resources to be able to accommodate the populations we're working with. And then also, when it comes to looking at different populations, it goes beyond the language. It's really the content and the wording that you're going to be delivering when it comes to the actual touch points, the digital experience, and the recommendation. Think, a construction worker down the street working on one of our buildings is going to need a very different message than a teacher at the public school for elementary also down the street. They're right next to each other, same area, but you're going to need to kind of alter that tone and the content of what those typical people's priorities are, and meet them on their level, and get that sense of familiarity and trust early on that, this experience is here for you. And, also expressing in our touch points that when they engage with us, there's a value on the other side. We're giving them that recommendation, and it's only purely based around their opinions and needs. So absolutely obsessive when it comes to segmenting that population down and getting it as personalized or individualized as we can.
I think this seems to be a very secret sauce of your success, because I think when we talk about patient engagement, it should seem to be a very personalized, heart-to-heart touching kind of an experience for the patient and the family. So I think that is quite phenomenally good. So now I would like to move to another topic, which is everyone is talking in the healthcare, which is about AI
Mm-hmm.
and all the platform which are uh, coming up, whether it is patient engagement or care management or anything. Everyone is talking about AI. So when we say AI, is it helping in getting better patient engagement, or do you think it poses some risk as well?
I do think it poses some risk, honestly, but we're working with it and we're training around it. The risk that I think comes in most is AI is very black box. So when someone says, "Hey, we specialize in this engagement," each plan has a different brand associated with how they want to communicate with their members, and you know what the protocols associated with what you do and don't say can be at risk if you're not able to truly control that. And so we really focus more on facilitating content associated with advising the plans, the systems on these are the messages that have worked best, or our platforms generating this type of content, and then allowing them full control on the other side to say, okay, no, we need to make these small adjustments, or this reading level is a little bit off. Some of those factors need to be accounted for, and you need to have that consistency. They've already been getting, touch points from the plan around payments, or, their sign up for your HRA each year, things like that. And so you need to have that tone fit the same. So because it's healthcare, it's really sensitive information. It's something that people are uncomfortable with. So I'm a fan of it in the sense that delivering at scale what you need to do when you're looking at the language, the design, the questions asked, it can do a lot to help, fill in, I would say 95% of the gaps. But that last 5%, we still need that human element on the other
Oh,
side that can express the care for them.
of course. AI will never be able to replace the human touch, because that brings the life to all the conversation and everything. AI is
Yeah,
plain and dry, but human touch, and when we talk about patient engagement, there has to be some human element definitely required, which the patient can touch and feel and smell, and they get a real feeling, lively feeling of the whole engagement.
yeah, exactly. We kind of, like I said, we're the support for the phone call centric outreach. Not everyone is going to resonate with it. So
Right.
let's get the ones we can, and then you can focus on that really, really refined touch point to those that need it.
Perfect. So when we talk about patient engagement, we can also think about gamification of this whole engagement experience. So have you thought about it to include in your solution?
Yeah, I think when you're trying to get anyone to take an action, gamification needs to be considered. It's not necessarily our primary driver to date in terms of how we're looking at it. I would say the way we really want to, at least upfront, present them is create that organic activation through that kind language, through that understanding that individuals are able to get that recommendation. And we see that really great in our upfront, just the people that are going to have that really proactive approach to it. We see around 30%, 25 to 30% click-through rate, 80% completion, and then 7x the sign-up rate. When someone goes through our experience, there is some gamification there, right? Hey, if you complete this, we will give you a recommendation that is aligned with your goals. But there are those harder to move individuals that need that extra step. And that's
Yes.
where that piece kind of comes in, where okay, we might need to incentivize, or can we create a tracking of all your screenings and let you know which ones you have and haven't done? If you do these things, you can get this particular benefit or this cost off, whatever that might be. And I think a really great use of gamification in healthcare is less around maybe focusing on a financial incentive, whether it's, it's a gift card to Amazon or, a free coffee, things like that, and more around how can we promote health with alternative options? Hey, we'll send you an air fryer or something if you sign up for the nutrition program. Things that can promote a healthy living and a healthy lifestyle around them and give them that goal while also applying a way for them to live a better life for themselves as well.
Right. I think at all ages, people like candies, and they need to get incentivized in whatever. It may not be monetary, but people like to get incentivized in some shape
Yeah,
or form. So,
exactly.
but
And it's something, as we continue, we will continue to be working with gamification and tracking that. The big piece around that makes it so difficult, again, is what is the plan? What is the systems kind of formatting to that and presenting that actual reward or incentive, what that might be? You need to have that aligned with them. And so that needs to be really calculated into what your recommendations are doing and when is the best time to initiate something like that.
yeah. So, when we talk about AI gamification or integrating the solution with other systems, so do you see there is any security risk, and how do you ensure that ensure the security of patient data?
Yeah. So, I mean, I think anyone in healthcare, I don't need to really say it, but I will. It's essential, right? What are we doing and how are we engaging them and what are we doing with their data on the backside? And first and foremost, we act as a white label or a third party solution to the plans or the systems, and we express up front, one, the data is secure within their system and we are just using it in that moment. We then only have more aggregate level understanding if a plan were to terminate the relationship with us. So we're always able to scrub that. I know also when it comes to the communications you're handling within a particular channel, the levels of what you're able to convey in that message is very different. In a text message, you cannot say PHI related to them, versus in an email, you might be able to allude to, this solution is beneficial to you for diabetes management or whatever it might be. And then in postal, right, you can get a little bit more. It's the most secure version, as that's going directly to them. And you're able to add a little bit more in about what their personal circumstances and why this could benefit them. So really making sure we're staying up to date when it comes to those laws and regulations. And that includes, your HIPAA, your SOC 2, all of that. It's always fun, and it's always a tough process, but it's a necessary process.
Oh, it is definitely.
Ready to always accommodate.
Excellent. So, in our experience, we have worked on many patient-facing solutions as a developer, and we have seen that these kind of solution, when they are used, they have improved the outcome of the patients. So, what is your experience around it?
Yeah. So the first and foremost thing that we're really proud of, beyond just the vanity, hey, we drive a lot of extra results, is what are people saying about our experiences when they go through them, and is it resonating with them? And we found 70% of people going through our experience go out of their way to request more for us, and we'll provide up-to-date contact information. When we work with plans or providers, whoever it may be, usually about 25 to 40% of their contact information is wrong or outdated, or it's a landline, whatever that might be. And so they're already struggling to get that for them. We are, when we present this positive experience, they are actually opting into that for us. So that's the first thing. Then beyond that, it really comes down to what we are pushing to, because we are flexible associated with it. So let's take disease management as an opportunity, specifically diabetes. And you typically see around 3 to 5% of eligible members actually enroll in a disease management program. You're leaving a lot of people out there that are still, missing, or it's not resonating with them about what you are targeting them with. And so when we have that, we actually see around a 7x on disease management. So we're looking at that around 21% sign up rate when someone is going into a risk averse experience. So that is where we kind of hold our North Star to, is, are we driving the optimal outcomes? And then taking it a step further, because our platform allows for us to determine, is this a good fit for this person? And so say we were to push someone to a solution, you might say, success, great, they signed up. No, actually, a month later, after going through onboarding, maybe it took labs, it took a lot of time with the practitioner to go through setting them up, and then they just go dark on that company. And that's a lot of resources that are actually not real, are being wasted. And so we also look at, how are we going to be making sure that this person is the right fit and that they're going to stay in that program. And that's a big piece of this as well, is that continuation going on with them. And we want to not necessarily engage on how they're how to better live their healthy life if they're in a disease management program. But we want to check in with them, make sure things are okay. And if they're not, maybe we can adapt what we're doing, what we're offering to them, and presenting them with a better solution versus, all right, I'm frustrated, this isn't really what I want. And now they go dark. Now you have a really, really upset member at that point, and they are now going to disengage from all future communications. So being there and being upfront and knowing what is and isn't working and adapting to their needs with additional, care options or plans, things like that, is going to be also that piece that helps them stay in programs, or maybe find a program that's better for them once they start a sign up process, not once they, commit all the way through and devote those resources.
Excellent. So you yourself is a Healthtech founder, and so before we conclude, do you have any advice for fellow Healthtech founders? Any kind of piece of advice you want to give?
Yeah. So where to begin on advice for being a health tech founder? One, I would say you need to just not be afraid to let yourself go and be capable of learning on a regular basis and adapting from what you're learning. And that might be, getting absolutely torched by someone at the C level for a big pitch. But that actually is a fairly positive outcome because there's something you can take out of that, right? You can now learn why and where it went wrong and how you can go about fixing it so that the next call, you're much more ready for it to be out there. And the second one, kind of going along that same lines of adaptability, is don't be afraid to adapt your platform to the people you're speaking to, listen to their feedback and mold what you have if you can. When it kind of seems like it's not totally clicking, you're getting to the last mile and you can't get over the hump. There might need to be some alteration to your message or alteration to your product so that you can really accommodate what your customers are talking to you about.
Okay, excellent. So thank you, Mike, for your time and sharing your insights and experience. And I hope this will help our viewers. And thank you very much, and we wish you well.
Thank you. Appreciate it.
And so thank you all viewers for your time, and stay tuned. I will soon come back with the new podcast on Healthcare Musings with Nilesh. Thank you.